Over 12 million Americans currently suffer from the lung condition known as chronic obstructive pulmonary disease, but there are treatments that can help ease the symptoms.
Chronic obstructive pulmonary disease, or COPD, refers to a combination of two separate diseases which interfere with breathing: emphysema and chronic bronchitis. While there is no cure for COPD, there are a variety of treatments capable of controlling the disease's symptoms and slowing its debilitating effects. The first step in combating COPD is to stop smoking. Without the interference of cigarettes, prescription medications will be vastly more effective against the disease, and lung deterioration caused by years of smoking inhalation will be reduced. The most commonly prescribed medications for those afflicted with COPD are a group called bronchodilators. Bronchodilators, like Alupent and Proventil, relax the muscles around the bronchial tubes, allowing air to flow unrestricted from the mouth to the lungs. There are three types of prescription bronchodilating drugs: beta-2 agonists, which are available in both short and long-acting forms, anticholinergics, which are short-acting, and theophylline, which is long-acting. Short-acting bronchodilators help relieve COPD sufferers at the onset of an attack, while the long-acting varieties help to prevent and control symptoms from developing. Since there are such a variety of bronchodilators, each with varying effects, your doctor will take your specific symptoms into account when deciding which medication or combination of medications is best for you. Another type of drug used to relieve the symptoms of COPD are corticosteroids, which are sold under brand names like Pulmicort and Beclovent. Corticosteroids are anti-inflammatory drugs that work over an extended period of time to lessen the inflammation in the lungs. These medications are available in a variety of forms. Most can be taken through metered-dose inhalers, dry powder inhalers, or nebulizers, which deliver the medication in a very fine mist. Corticosteroids can also be prescribed in the more traditional pill or syrup form. Oxygen therapy is often used to supplement medication and involves supplying fresh oxygen directly to the patient. This therapy may be prescribed if appropriate levels of oxygen are not reaching the blood. Supplemental oxygen can help patients sleep better, complete daily activities with less difficulty, and even prolong their lives. As a last resort, surgery may be recommended for people with more severe cases of COPD. A common surgical option is lung volume reduction surgery, in which small areas of damaged lung tissue are removed. After the operation, the diaphragm will be able to contract more easily, allowing an improvement in the airflow to the lungs. In the most severe cases, it may be necessary for a patient to undergo a complete lung transplant operation. Remember, not every treatment or medication is right for everyone. It's important to discuss the pros and cons of every option with your doctor and to follow your physician's instructions exactly.
During normal respiration, air travels through the nose, down the trachea, and into smaller and smaller airways called bronchi. Bronchi divide into bronchioles and finally into tiny grape-like clusters of thin, fragile sacs called alveoli. Chronic obstructive pulmonary disease, or COPD, refers to a group of diseases that cause airflow blockage and breathing-related problems. Emphysema is a disease that destroys the alveoli and the alveolar ducts. As your lungs lose elasticity, the alveoli rupture, creating large air spaces that reduce the surface area needed by your body to absorb oxygen and remove carbon dioxide waste. Bronchitis is the inflammation of the lining of the bronchial tubes. Chronic bronchitis results from the persistent inflammation of these airways. Mucus is continually produced, and over time the lining of the bronchial tubes become thickened. This restricts the flow of air during breathing. COPD is caused by tobacco, asthma, exposure to air pollutants in the home and workplace, genetic factors, and respiratory infections also play a role.
Audrey Sear keeps the sound of this machine out of earshot. It's a constant reminder of her struggle to breathe.
Says you've been very tired lately. I said yes.
That's because Audrey suffers from emphysema, a form of COPD or chronic obstructive pulmonary disease.
Go to get dressed, I lose my breath, continue to lose my breath. At this point now, I've had it, what, 7 or 8 years, I guess. And at this point now, if I go take a shower, I got to take it in the shower with me. So it's gradually gotten worse.
Many mistake the symptoms of COPD as a chest cold, but it's a disease that progresses.
You know, in the years that I've been working in the healthcare field for 25 years, I've seen a lot of folks with emphysema. What actually happens is that the air sacs within the lungs become damaged, and the individual with the emphysema starts to experience a lot of different symptoms that affect their quality of life.
According to a new study, as many as 1.6 million Canadians could have COPD and not even know it. The main cause? Smoking. And as Audrey knows, time, just like oxygen, is of the essence.
And there was a specialist there, and she said, you have severe emphysema. And if you don't quit smoking, you're not going to last too long. But if you do quit smoking, it will give you more time. But you're going to end up on oxygen. She told me that.
There's no cure for COPD, but there is treatment with bronchodilators like this that help open up the airways in the lungs. There's also supplemental oxygen, but the first step is getting diagnosed. Doctors recommend if you're over 40, and especially if you're a smoker, to get tested.
I do all my own baking, made my own bread. I can't need bread anymore. And I just like store bread, but I've stuck with it, I guess. If that's the worst that'll happen to me.